So we're going to take a moment to speak about a method that Edythe Ashmore describes in her book Osteopathic Mechanics. It is termed, I believe, the sit and elbow movement or something along those lines. I don't remember it exactly. But essentially what it is, it's attempting to create extension in the thoracic region. What it's suggesting that you do is have the patient clasp their arms behind their neck, bring their elbows forward, essentially, so sometimes you'd see people do this, but in the book she actually suggests that you have them hug themselves so that you have something to grab underneath and then to create extension essentially by lifting them there and pushing on the T-spine itself. So just give yourself a hug, right? So depending on the size of everything, what you end up doing. Now in this case, just because of the height of the stool that I'm using, it's fairly low. I do have to come in underneath, but essentially what you do here is you lift, right? Now what I want you to notice is as I lift, I'm going to come around the other side so it's more visible. As I lift, if you look at his back, nothing really happens, right? So what I'm trying to do is create thoracic extension. So I have to lift and start to bring him forward. So you have to do essentially what's called a drift. So you have to drift him forward. So it's almost like you're creating a lumbar flexion so that you then get your lift. Now you don't want to do it this way with your arms. And again, we want to talk about concepts that we utilize here and that we discuss over time. So the idea of the space between us is unstable, right? And contact is control, control is safety. So you minimize the negative space, you walk right up to them, you essentially put your abdomen on their side. And then you have a lot of contact. So you have abdomen contact, you have arm contact, right? And you lift here. Now, I've spoken about this early on in my patient positioning series. So I'm going to show you where I can get him to, right? As far as extension is concerned, keep your arms there. Stick your tummy forward, look at the sky, extend as far as you can. That's as far as he can go. So if we compare that, relax. That's kind of where I get him. If I really want him to go into a lot of extension, I have to really drift him. So there's more effort for me there. So what I suggest in a method like this, should you be choosing to do thoracic extension, sit tall, as tall as you can, right? There you go. And then now I take him. I give him the rest of the motion. So I have him position, relax. I have him position into extension somewhat, then I take over. So I don't have to do all the work. So even if I'm using good footwork and I've got good contact and I just kind of lean my body almost like I'm dancing, I still have a fair amount of work to do with respect to mobilizing the patient. So what we want to do is be careful with how much work we actually end up doing. So just to give you a different angle on this, to show you that it doesn't have to be strictly sagittal. It can be strictly sagittal. However, you can engage other planes of motion, but understanding that because you're standing on one side of the patient, you're going to have a bias as well. So we're just going to have you swing and face the wall. Right? So here, give yourself a hug again. Right? We take him, sit up as tall as you can. Right? So we get him to lift himself. So I can create the extension here, right? So you're going to see, again, you're going to see his whole body kind of roll forwards, but then the extension's here. So relatively speaking, as I'm drifting him, I'm creating some hip flexion, but because I'm dragging him forwards and I've got my arm underneath his arm, then what I can do is get that extension. Now, because I'm on one side, should I want to, if I lean this way, I can get some side bending. So I lean this way and I lift up on the other side, I can get some side bending. I can get some rotation too. I have to be careful. Rotation's easier to do than side bending with a hold like this, and all I have to do is shift my weight, walk around him, so I can do that as is needed. Depending on what is required for the situation, because I've got a good hold and good contact, I can get into that thoracic extension. I can add in the coronal plane and the transverse plane should it be required. However, this is clearly best for the sagittal plane with a caveat. If I have to lift him the whole way, I do too much work. So I will have him sit himself up, followed by me engaging and me doing the rest. I'll have him kind of create his own extension before I do anything else. Now if you flip and face that way again. So just as an alternate hold so that's visible, clasp your hands behind your neck. Keeping your elbows forwards, right? So here, there's a hold like this that some people will try to use. You can't see it, but basically the size of his forearms, they're not going any lower. So His forearms, his biceps, they just don't go any lower. Also, he runs into his deltoid, so he doesn't go any lower than this. This is another hold, okay? So you can see a little bit more clearly. What I'm going to do is just sit up tall, right? Sits up tall. I don't have to do that work, and then I can create the extension just by leaning, right? But, well, let your arms relax. If I were to simply lift him up and try to extend him, I'm probably not going to get as much extension as he has available. Also, I'm probably not going to have an easy time of it. I've got to do a lot of work. So contact is control. The space between us is unstable, right? So minimizing negative space. Contact is control. So the more contact you have, the more control you have. So you're nice and tight to the patient. You're having the patient position into correction more or less. So you would have already assessed this. You can utilize other planes. The easiest other plane to use in a hold like this in a seated position is the transverse plane. The coronal plane can be used, but it is difficult. So hopefully all that comes together for you to understand how to take the base hold and the base motion that Edythe Ashmore suggests in her book Osteopathic Mechanics, and then to understand that the same concepts apply. So contact is control, control is safety, the space between us is unstable, position to correction, all of these things. And then should I want to go direct or indirect? If I want to go direct, I'm looking for some tension, some bind. If I want to go indirect, I'm using that hold in a gross sense to create softness in the region I want it to create softness. So, and then also if I want to add activating forces, I want to be more or less organized, well actually more so organized. So in this case I wouldn't necessarily be able to create as much compression or distraction, but I would be able to create some torsion and shear. So I would go torsion, shear, depending on which one worked, or if both worked I would use one or I would use both. So again, being organized, using all the concepts that we've talked about before to take this base hold and make it what is necessary for the patient in the moment.